want to prevent a disease, usually with public health, we look at it from 4 different levels. Where you look at, in school, they tell us there's the primordial prevention, and then there's a primary, there's a secondary, there's tertiary, and now they've even added a 5th one, which is quaternary. Let me talk to you about the first one, because I think if we look at sickle cell a lot from that angle, it probably would help. Primordial is talking about how do we reduce and intervene? What interventions can you and I put in place to be able to reduce the sickle cell trait itself? Because if the person has the trait, that's when you find them in the hospitals, the sicknesses and all that. How do we reduce the traits? Once we talk about reduction of the traits, then perhaps we would look holistically at the problem. I think that if we got our young children, school-going age, from primary level, I know that the SHEP coordinators have a health program that they run in the schools. I would say, why don't we talk about sickle cell to our young ones? Because it's the young ones who grow into adolescence and say they are in love with somebody who has AS, and whatever you say, they will not hear. So if we start early and let them know that there's this thing that we don't want. We don't want you to have a child that has a sickle cell trait. Say it early, inculcate it in their mind so early that once they are growing up, they know that there's this thing we need to avoid.
You money are you on many? Are you a chwe ni chwe ne ble makwe anale sunhela alo mumomi hela shimene dromona ni ashipamo e ana na ke je sunhela ni shimo hela ni abanya fe eko no follow ke sumolo no he adafi atwane ake no ko aka wo egbe no ko aka wo segbe shimo ke won chi won be ke doctor foye ni wo le no ni gba no ni yo wu ya mi e amamba chon.
So like we want to give back to the society, so as a part of our corporate responsibility, we are always partnering with PML in sickle cell disease, and that's why we have also adopted 25 kits and we'll be giving our zinc syrup free of cost throughout the year, not just once, it's throughout the year. Continue. So it's like partnership. So we'll be continuing throughout.
Information presentation kwanya ubano owo na esi orobi agenti a obetumi enye. Say we're checking it here. Now, AS. Papa Nisu can say on Muslim journey AS. It's me macho. Yeah, there's young baby Accra. So those who are aware, so who can hear AS? Now who organize we are AS? I think there is a probability to say Oba Woman Obetumi ISS. Now that probability no na yebe jane bi achram na motumi ati asiye. Jam patome stress munye mu be kata moni amame. So ada kana mukita muso nema. Acho kata weni nei bone woman neba. Acho mutumi. Acho mpijana ubi. Acho mushe ene eyede. SS. when you now move so many years, Papa to years. Where you be already trained at the Elu Chester on your first time and you need some Apalano SS. Then on you send here out the panel. Apalano let me ISS, AS, and answer AA.
Doctor said, this is a mutual affair. The same mutual meeting to